Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
They both skirted around the oral restriction piece and were like, no, he's fine. He can latch. The problem was he wasn't staying on my breast. He was popping on and off. And that was the first big sign. I wasn't experiencing any nibble pain or anything like that just yet.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today we're joined by a special guest, Casey Quinn-Daly. Casey brings a unique perspective as a first-time mother and seasoned speech-language pathologist with a passion for empowering families. She has a diverse background spanning acute care, inpatient rehab, and skilled nursing. Casey's expertise shines through her work as the community and content director for the Medical SLP Collective. Her recent presentation at the ICAP conference on collaborative care and caregiver cognizance reflects her commitment to advocating for comprehensive support systems. Join us as we explore Casey's journey navigating her son's oral restrictions and releases and uncover the insights she's gained along the way. Get ready to be inspired and informed as we discuss the importance of education, empowerment, and collaboration in optimizing the health and well-being of our children. Welcome, Casey. I'm thrilled to have you, and it was that presentation that you gave at the ICAP conference in Cleveland that inspired me to hurry up and get you on the podcast. So thank you for that presentation, and thank you for being here today.
Thank you so much for having me. I'm so happy to share my story as long as it helps other people.
And I know it will. Because, and do you mind me saying a little bit about what your presentation was about?
No.
So
yeah, that's totally fine.
Yeah. So not exactly like what it was exactly, but the reaction that it had was at the end, most of us in the room were crying. We were moved to tears by your story because you had been failed by the system that we are all a part of. And I
Yeah.
hear this story again and again and again in parents who are lay people. But you knew all this stuff and still you didn't get the respect that you deserved. So, thank you for being so brave and vulnerable and sharing your story. And maybe we can dive in a little bit and talk about what actually has
Yeah.
happened with your son.
Sure. So I will start from day one, basically. So when right after Sully was born, I noticed that we were really starting to have difficulty with feeding pretty much from the get-go. And my first experience with lactation consultants, IBCLCs, was in the hospital setting. I wound up seeing 2 IBCLCs, and I know I shared a little bit of this at ICAP, but they were on very completely different pages, and it was very evident when I saw each of those consultants. And from my perspective, it was actually really confusing and frustrating because I was like, I don't know who to believe, what to believe.
So, in other words, those 2 lactation consultants in the same hospital gave you different assessment and advice.
Yes, completely. They both skirted around the oral restriction piece and were like, no, no, he's fine. He can latch. The problem was he wasn't staying on my breast. He was popping on and off. And that was the first big sign. I wasn't experiencing any nibble pain or anything like that just yet. But that was the biggest piece. And then in terms of like my own anatomy, I had one IBCLC who is like, a baby can latch to anything. Don't worry if your nipples are inverted or flat. We can work on it. And then I had the other IBCLC saying, here's a nipple shield, try a nipple shield, use a nipple shield. And, I'm not an expert, but I have heard that there's like, depending on the person and variation, like it may or may not impact supply, but none of those things actually really were brought up to me. It was more so like, let's get them feeding.
Right. So yeah, let me interrupt for a minute and make a couple of explanations for those who may not be familiar with some of the stuff that happens very early on in the hospital. First of all, I always like to explain the root cause of what goes on. The idea of what they have to accomplish in the hospital is to get you out of there. Right. No matter what anybody says about care and this and that, the goal is get the baby eating, gaining, so we can discharge. You stable, baby eating, and then it's the pediatrician's problem. I know.
Yeah.
I worked in the hospital for 28 years.
Yeah.
Right. So first of all, not all lactation consultants have the same education, right? And maybe not even both of those were IBCLCs. They could have been, but maybe not, right? Because lactation consultant can mean a lot of things. And I'm really sorry that you had that mixed message experience. And then 2 other things you mentioned was IBCLCs suggesting nipple shield and the fact that they skirted around the issue of saying tongue tie assessment or diagnosis.
Yeah, they wouldn't even I think I mentioned it and like they were like, no, like they didn't even like really acknowledge like that could be a potential issue.
Right. So and that might not be their fault because in some institutions, no one is allowed to say the word tongue tie. So, not that I want to defend them, but it might not be their fault. It's kind of disgusting, really, that some people's hands are tied or their tongues are tied, literally, pun intended, around the topic of tongue tie. But there's a way to get around that, so.
Yeah.
But then again, like if you're a lactation consultant in the hospital and you're listening to this, I'm not dissing you. I was you. I'm just saying get more education. There's plenty, there's plenty of courses. We don't learn about this in school. We don't learn enough about tongue tie in general lactation education. So keep going, keep learning because it's not going away. Like we have to know this and as you hear Casey's story, you'll understand why we have to know this. It's just not right. And yeah. And then the nipple shield is a mixed bag, because sometimes we can get the baby to latch, but the baby's not transferring. But if it's fitting you right and the baby's transferring, and that's the only way to get the baby to latch, it's a tool to use. But it really has to be guided, because it could look like he's eating, right, to a mom who doesn't know, and he might not be, right?
Yeah.
So,
yeah. And
bag.
I know for us too, we struggled a lot with him just falling asleep at the breast all the time. So looking back on it, he was just probably working so hard to just try and extract and, get what he could. But that was like a pretty consistent problem as well for us.
And it's pretty common. And that's one of the symptoms, that the baby just gives up because, they're just too tired. It's too much.
So once, another thing that was also like in the hospital where I was a bit confused was the issue of a pacifier. I had one person tell me, don't use a pacifier for 3 weeks. And that was the same person who said, don't use a nipple shield. And then the other person was like, if you have to use it, use it. Like, it's a tool, like, you're the one who's going to be at home with your child. Like, if they're really fussy, like, don't think you have to hold out, if you want to use it, use it. So that was the other thing where, like, just completely different, like, opinions.
Without giving you reasons. Right.
No reasons.
So at least give you reasons for informed decision making. Right. So my reason for not using a pacifier in a breastfed baby before 3 weeks is that the baby is going to be satisfied and sometimes fall asleep instead of getting up or not wake up for feedings because they have the pacifier, or, being soothed by the pacifier enough so that they don't want to eat or don't need to eat. Their instinct is to suck, and they suck. If they don't get any food, they'll still suck till they fall asleep, so we want to be really careful. Pacifier is important for a baby who's preemie, not nursing. There are definitely times to use a pacifier, but never to leave a pacifier in the mouth, except for a very preemie baby that's their only oral stimulation. That's a different story, NICU babies. But as far as a full-term baby who we want to get to the breast, the only thing a pacifier will do is quiet them. Maybe, because not all babies can even keep one in their mouth. That's the other thing.
And he was one of those babies. He was one of those babies where we were pretty much done with the pacifier by probably 4 months, and we used it sparingly because it would just come out of his mouth and like he would wake up or. And then we would remove it. If he happened to fall asleep with it and keep it in his mouth, we would be able to remove it.
Good idea, because I had 2 kids that were older than 3. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code podcast15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much.
Yeah.
I don't speak because I did all this right. I teach because I got it all wrong.
Yeah. So, I mean, that was just our experience,
Yeah.
If we have another child, we might be battling something similar, Everyone has different stories.
In my language to my in-person patients, I say use it for emergencies. You're in the car or painful procedure and you can't latch the baby at the time, or, you're just getting out of the shower or trying to eat and your partner is trying to soothe the baby, and I don't like babies screaming.
Yeah.
So I'd rather that pacifier for a couple of minutes. It's not going to destroy anything for a couple of minutes a day to use a pacifier, but hours on end is a different story. Mm-hmm. So at the hospital, were they pressuring you about weight gain or weight loss, or?
They were. Yeah. I felt very pressured to supplement pretty early. And that wasn't from lactation. That was from nursing. Mm-hmm. And, I had and I almost wish I didn't do this when I think back. I had packed my own bottles and formula in the event that, I would have needed it. Mm-hmm. And I brought those in. And then I guess, the hospital has their own mini disposable bottles with formula. So nursing was like, yeah, just mix the formula and then we could use that. But when I look back on it, that was not even the proper instruction on how to prepare that formula. Mm-hmm. So I think that was also something that I was like, oh, wow, I didn't even realize that at the time, but they didn't even properly instruct me on how to prepare formula.
Right.
So, but yeah, they were very insistent. Once the colostrum that I had brought with us to the hospital had kind of run out, they were like, okay, I think you should start supplementing if he's not,
Did anybody help you to hand express, or you knew how to hand express, but nobody encouraged you?
I did know how to hand express. They did bring me a hospital grade pump, but they didn't have my flange sizes.
Oh.
Yeah. So that would be something else I would do next time is bring my own pump. Mm-hmm. Yeah.
Yeah.
So they didn't
it's
have
a shame that you
sizes.
had to go through all that. I mean, just in those first days when you're dealing with so much else, just feeding isn't the only thing you're dealing with. You're dealing with your hormone shift, your recovery from the birth, your, bleeding, all the stuff.
Yeah.
Emotions,
all the things.
Not sleeping. Mm-hmm. Physical discomforts of having been in labor. I'm assuming you were in labor.
I mean, I will say that for, I guess, having one child, my labor was about 14 hours. Mm-hmm. And it did progress pretty quickly. I did not have an epidural. I just managed my pain with a TENS unit. So it was moving pretty quickly. Mm-hmm. And I had a doula who was also really helping me with
good. I'm glad
changing
you had
positions.
That all set up for you.
Mm-hmm. Yeah.
So, what? I don't know if anybody has said this to you, but as a midwife, you optimized everything for the baby by having that natural birth, by having the support, by not having the epidural. And I don't mean that to, say anything negative about people who do, but
yeah.
We all know that all of those things can have a little bit of an effect. So you optimized everything that you could for his being able to be born and breastfeed. He was term, right? He was.
I went into labor at 39 weeks, 6 days.
Right. So it was perfect, right? Everything up to that point was perfect. He was healthy. Yeah. You did everything that you could to set him up for a good ability to nurse. And then the hospital dropped the ball. So you go home. Now you're partially breastfeeding, partially supplementing. You still have to pump, I'm assuming.
Yeah. So I wound up actually finding another IBCLC/SLP who I set up an appointment with, and we went to see them. And they also did not identify any oral restrictions at that time. So that was like my third provider that I was with at that point. And I guess also from my perspective, because I am pretty aware of oral restrictions, you know, I was like, okay, maybe I'm just hyper aware of this. 3 people are now telling me that this is not something that they're seeing with him. You know, okay, like let's see how this goes. And a lot of our sessions were of me nursing with nipple shields. We tried without, but like I said, he was still like popping on and off the breast. He was still falling asleep. And a lot of it was centered around weighted feeds to see how much he was transferring.
Yeah. Did he have reflux at all?
He didn't have any like overt signs of reflux. The biggest thing that I would say he had was aerophagia. He would get fussy right after feeds, burping. He wasn't really vomiting or bringing anything back up.
But a lot of gas and distress.
A lot, yes. Yeah, a lot of gas. Like we were using gripe water pretty much consistently with feeds. It was usually a little bit worse at night. That was like the biggest piece besides him obviously about like not being able to remain latched and being really sleepy.
You know how you said you were aware of oral restrictions? I've had quite a few SLPs come to my office with the same or similar story as you. Like, oh, but I know it's not a tongue tie. And it's almost like a cognitive dissonance, like because you don't want to diagnose your child, so you're like, what are the chances?
I just want to be
my child, right? So like, I don't know if you heard there was another presentation of somebody talking about her grandson, and I had a similar experience with my grandson. It's like you kind of are praying that it's not going to be there, and you're afraid to look. And then you don't even, it's like, oh, maybe it's not. Oh, no, maybe it's not that bad. Maybe it's not that bad. Yeah. So, and then if you have other medical providers that probably have more expertise in infants than you, telling you, no, it's not that, you just, there's no reason for you to think it is, right?
Yeah. Yeah. And that was the thing. I was like, okay, well, now this is like person number 3, you know, maybe this isn't something, and we're just, you know, have to
and that was
try
just
and work
person
a little
number
bit
3 of lactation. How many other medical providers up to that point saw you? Pediatrician,
so just
right?
The pediatrician we had seen for our normal like visits, and obviously, you know, everything's like, oh, keep going to lactation, or you know, follow up lactation if you're not. So that was he was about, I think, 6 weeks old when I said, like, described this to a friend, like, I don't know, like my fog lifted, and I literally just flipped him over and like lifted his lip up, looked under, took a video, sent it to a friend, and they were like, why don't you just get another opinion? And I'm like, okay, that's my next step. So that's when I actually, you know, was able to get a referral from my doula. And that's when the ball started rolling. I had someone who came in and did a very comprehensive evaluation. She was at my house, I think, for like 3 hours. And I know you mentioned that when you talked during your presentation that you get stuck at people's houses, right?
Never leave.
Yes. So, you know, we came up with a plan in terms of like, okay, we're going to get you in to see the dentist. And then these are some of the things you can do, you know, for right now. And then, you know, we had an amazing experience with the dentist. They did not release it then and there. They kind of just went over everything, provided like risk benefit, like informed consent, you know, when they completed the functional assessment, honestly, like his tongue was pretty good. You know, he had some restriction, but it was pretty good. It wasn't like it was tethered to the tip. It was more of a posterior tie. His lip was a little bit worse than that. And then, you know, just based on the symptoms that I was experiencing at that point, you know, I was starting to experience that pain when nursing. And, you know, we were continuing with the aerophagia, popping on and off. The getting sleepy at the breast. So we decided to ultimately move forward with the release. And that experience was great. Like, I felt very prepared for that
That's key,
release.
right? I mean, that
Very prepared.
so many people go in and
Yes.
aren't really prepared and ready, and the baby's not ready, and so
Yes.
you were
Yeah.
fortunate to find the right team finally. It shouldn't have
Yes.
taken that long, but
No. Yeah. And he did really well. The stretches he did really well with. And then, to be honest, like, immediately I felt a difference, not only nursing, but with bottle feeding. He had such a deeper latch. And then I think by like 2 weeks post release, we weren't using gripe water anymore. Like, his aerophagia was completely gone.
Right.
For me, though, like, my supply already kind of started.
I was going to ask you about
down.
that. If the baby's not efficiently removing milk at each feeding, they may be getting enough, but they're not really stimulating you enough to keep up that supply.
Yeah. So my breastfeeding journey ended around 4.5, 5 months, just because of my supply, and it was, I think, better for my mental health at that point to move towards just.
So let's flip that around. You were able to breastfeed for 4.5 to 5 months. That's more than a lot of people do, and you gave your baby a lot of wonderful nutrients and other things, right?
Yeah. And then I would say, so I know, when I did my talk, and people were really, really surprised at the number of providers I had seen. So my son is going to be 16 months old, and he has seen 17 providers, a mix of not only like lactation pediatricians, but I did switch a few providers in between, because I felt like I wasn't getting what we needed for him at the time.
Good for you. They work for us, right? As healthcare, consumers, we are consumers, right? And like,
yes.
I used, I think, 7 pediatricians for my kids. Like, I just kept jumping around, and still, I never found the exact right one. So it's hard.
It is really hard, and he not only has some feeding difficulties, but we're seeing OT, and he was seeing physical therapy. So now, obviously, going along with that tongue tie piece, one of my really big concerns was something like torticollis. And that was one of the things I actually expressed to my pediatrician. He's not holding his head up in tummy time. He's had the release now. And they were like, look, he's holding his head up fine. I'm like, yeah, when he's sitting up, but that's not the same as him being on his stomach. So they did provide that referral source to me, but I did have to push a little bit for it, and
how many babies fall through the cracks? Because if you didn't know what you know, that kid wouldn't, the kids that parents don't know, they fall through the cracks until it's a real problem, right?
Yes, until it's like a weight loss issue.
So 17 providers, and we talked about, this was literally like medical gaslighting that you experienced. Do you want to talk a little bit about that?
Sure. So I can share a few quotes that providers had said to me, in terms of things that I was questioning about. One of the ones was, well, maybe it's just your body, in reference to like my milk supply. Another one was, he's getting all of the iron he needs via his formula. And that was me just inquiring about blood work for him because I was concerned about like low ferritin or iron, and because I had taken a course about sleep, and he was really
my
different.
Grandson had low ferritin, and they did his hemoglobin and hematocrit early on, I think at a year, and they said it was, my daughter didn't even hear from the doctor, so she just assumed it was normal. And then I said, you know what, go back and ask them what it was, and ask them to draw ferritin. And his ferritin was low, and he was having sleep issues. And once she started supplementing with iron, it came up. And they hadn't even told her that his H&H was on the low side. So
Yeah.
It's crazy. And these are
It is.
pretty good pediatricians that she's happy with for every other reason, So
Yeah.
so many things fall through the cracks. We have to advocate for ourselves. And you know why I think that happens? Why they're telling you, oh, it's enough? Because they don't understand the connections. So you know more than them. So in order to feel important, that doctor had to make it like what you were saying wasn't important. And that's definitely gaslighting, right?
That was the day that I left that practice and called another one. Because at that same time, and we also know that around the 6-month mark, that iron store drops because they're starting to move towards solid foods. And, I was just like, he's really off. Like, he's been off for a few weeks. Like, I know my kid, this,
your
these
kid,
are the things we're experiencing. So something else that had happened around that time that, never happened before, he had like this really strange staring spell. I couldn't get him out of it. And something else that was said to me was, oh, he probably just zoned out.
Wow.
And I was like, this is not something that normally happens to my child. So that was, so we wound up switching providers who, when I went in and talked about all of my concerns, all of his medical history, the course that I watched, all of the things, I didn't even have to ask for blood work. She just gave it to me. And I didn't even have to ask for a neurology consult. She just was like, how do you feel about a neurology consult? And I was like, I think that is the great next step. So all of this to like say that we went to neuro and they were identifying some things that we were seeing in physical therapy with some weaknesses on one side. He was having some asymmetries. And they recommended an MRI and an EEG, which we went through, and they came back technically normal. The MRI did. The EEG was mildly abnormal, but they didn't think it was anything specific or could correlate to anything that we were seeing. But, it was really interesting. And I was sharing the story about iron and my concerns with the neurologist. And she's like, when kids have low iron, they tend to have breath holding spells. She's like, I wonder if that's something that could have been what that was. And I was like, it was right. So it wasn't anything apparent that like it looked like he was holding his breath or anything like that. The other problem was I was driving when all of this was happening.
Oh, okay.
So she was like, that could have been something that had happened. So which would have actually went back to what my original concern was.
I have somebody that what you just said, I'm going to talk to somebody who's got somebody who's being tested for stuff and they can't find anything wrong. I wonder if they checked his ferritin. Very interesting. See how we learn from each other?
It was really like, I was like, I had no idea. That's super interesting. But I would think that maybe that would be something that like a pediatrician would be aware of, right? Especially if that's happening in kids, that could be one of the things. So when we did do his blood work, his iron was actually on the lower side of normal. So it could just be that it's not optimal range for him too. And it could have been lower, before that. We don't obviously have the proof of that, but
So what, if you could give a message to healthcare providers in the, everywhere from your experience, what would you tell them?
Listen to your, not only patients, because I'm talking like this could be anyone. Listen to your patients. If they're adults, listen to them. If they're caregivers, if they're parents, listen. Just stop and listen, because you're going to learn a lot. Because number one, if we're advocating for ourselves, we know ourselves, right? We know when something's off, and a parent's the same way. When something's not right with your child, or when you have questions, there's a change in status, or there's something there that wasn't there before. I would just say, just stop and listen. You probably could gain a lot of information from parents. What is the average time that we spend with a provider? If we're lucky, 30 minutes.
Right.
What about the 20 like 23 and a half more hours in that day.
Yeah.
Who's with that child?
Yeah. And most places, it's not even 30 minutes. I mean, around here,
Yeah.
pediatricians have like 12 bookings an hour. It's ridiculous.
Yeah.
So, and also one of the important points that you made that I'm saying all the time is about following your gut instinct as a parent.
Yes.
Like I often say I would make that a bumper sticker if I could, listen to your gut. You know your baby more than anyone. And I even say that to parents who are my patients. I'll say to them, I'm going to tell you this. I'm giving you sources to learn this, and this. You're going to hear other things online, obviously, right? On the internet, on Instagram or TikTok. You're going to learn all these things. But only listen and sort out what feels right for you and your baby.
Yes.
Because there's no right or wrong when it comes to your baby. It's only what's right for you and your family. And that goes for tongue tie, that goes for feeding choices, all the things. And I say to them, you don't even have to listen to what I'm telling you. Like, I'm not in charge of you. And I think that more providers should do this and say, here's your options. This is what I think, unless it's life or death, right? I mean, this is what I think you should do, or this is one of the options and why. This is another option and why. And whatever you decide, I will support you. If you don't want to do this, if I think you should go to this provider and then go to that provider and, maybe have some body work and then a tongue tie release, and that doesn't feel right to you, you can still come back to me for lactation. I'm not going to judge you. Right? So if more people said that, and I know a lot of IBCLCs that speak the same language as I do, and I'm sorry that you didn't meet them in a timely manner. But I mean, we have to, the instinct has been like bred out of us because we're told that the doctors are in charge. Right? And they're not.
Yeah.
We're in charge.
Yes. We are in charge
of our own
healthcare. I think something else that I would really recommend just for parents, like if there's something specific like that you feel like is wrong, I would find someone who specializes in that specific area. So like if you receive a specific diagnosis or if you're seeing something specific going on, I would really research and look for someone who works in that area. So for Sully, when we were starting solids and I was seeing we weren't progressing, I was looking for someone who had a very significant background in pediatric feeding.
Perfect.
And that was something that I feel like really helped us. Same for OT, someone who really has like a motor focus with fine motor skills and things like that. I was looking for someone who's specialized in
that's a really good
that,
point because like even as a speech language pathologist, you learn broad and then you specialize, right? So not every speech language pathologist is comfortable with feeding therapy.
No, not every speech language pathologist is comfortable with peds or adults.
Right.
There definitely is, we can definitely niche down in our field.
Yes.
And, I would really, urge people to find those who have a niche, not in just speech, but, anything. Like I said, torticollis, like if you're suspecting torticollis, I would want to bring my child to a provider who specializes in that assessment and treatment of, and I think that's really hard to do sometimes too. And it took me a while to build my team for him, but we finally, made that possible. And I'm really happy with the providers that we have. I really feel heard. I feel seen. And they know, what my goals are and for him and, honor that, in every session, they check in with me to see like, okay, what kind of week is this? Like, do you think these are things you can do at home? They're very individualized, and that's honestly the care that everyone should receive. It should be individualized. It shouldn't just be like, here's a sheet, go home and do these exercises. It should incorporate like what the patient family's, goals, preferences are, all of those things.
Cultural aspects.
Yes. Yes.
time management issues and,
Yes. I think time management is a big piece.
Yeah, especially if you have
for
a lot of
lot of
therapies to do with the
people.
child. It's really not easy, We can
Yeah.
we can give a list of, oh, go see this one, this one, this one, and that one. And sometimes there's just too much. So I've narrowed down
Yes.
my choices for people. I say, pick one. Unless
Yeah.
it's
Yeah.
specific, like you say, there are individual, like I know if a baby has a certain type of issue, which provider would be better for that particular baby. And I sort of say that, but
Yeah.
we can only do what we can do. It's another lesson I learned from my daughter and my grandson is, I can want her to see the PT, the OT, the CST provider, and lactation, who is me. Well, but you're living a life and you're trying to fit it in and you're trying to recover and you're trying to, get yourself back and all the things. So we have to respect that. Well,
and then
Casey,
I think also
go ahead.
to the providers out there, if you are niching down in a niche area, you need to let people know that too. Because I think that's also sometimes why we're like, where are these providers who do XYZ? And then it's like, oh yeah, I have a friend who does it, but they don't really talk about it or advertise. So if you are a provider, like share your niche areas.
Yes, absolutely. And find networks where other providers doing other things can get to know you. And that's what we have going on in my local area, which is kind of nice. I know, name any type of provider, I can find them now. It wasn't always like that. But now I can, because we have a local, like we have meetings and stuff, and it's fun. It's fun and it's intellectually enriching, and we learn who to refer to and who's comfortable with what. And we realize we're not competing with each other, because that's another thing that goes on with providers. Like, well, if she uses her, she won't use me, and then I'm going to miss out. And it's definitely not like that. We lift each other up, right? Totally lift each other up. So Casey, thank you for your time. Again, thank you for being so vulnerable with sharing your story. And I hope that it inspires both parents and providers to be cared for in a more human, holistic, and supported way. This was wonderful. Is there anything that you'd like to add before we sign off? Do you want to tell us, a little bit about your business or where we can find you? I hear rumors of a podcast starting.
Yes. So I would love to provide a platform for people who have similar stories to me in terms of finding providers, because ultimately I want people to have access to the care that they need. And I think we can all learn from each other. That's why I'm sharing this story. And I built my network, so I would love to help people build theirs and find the providers that they feel aligned with. So I'm in the midst of starting a podcast called the Mom Gut Podcast.
I love that.
Yeah. And you could find me on Instagram, the Mom Gut Podcast.
And I'll put all the links below in the show notes. So thank you for your time, Casey. It was wonderful to see you again. Can't wait to hear your podcast.
Thank you so much, Lisa.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.